And now we're talking about getting back in the game for athletes. High school students can now return to play with proper precautions, that is. We're discussing how they can play safely and the downside of not playing. Midwest Orthopaedics at Rush, Dr. Nikhil Verma joins us now. Thank you for being here.
Thanks for having me.
So many athletes and their parents are really excited about them going back, but they have not been really practicing at the same capacity. Are you worried about injuries, or what can they do to go back safely?
Well, I think that's a great point. Whenever we see patients who have been inactive for a period of time or functioning below their normal level of activity, if they trend to rush back to sports, we do worry about some of the acute injuries happening. Things like ACL tears or hamstring injuries can be problematic. And we actually went through this as we ramped up the MLB season back June, July, after the shutdown during spring training. So I think, fortunately, there are some guidelines in place to help ramp up on a more graduated basis. And I think we need to be cognizant about the fact that you can't just go from 0 to 60 overnight.
So when we talk about injuries, let's also talk about the rest that they have had. So many of these kids are going full speed all year long. Did the rest do them some good?
Absolutely. There's no question that we've seen a real problem with overuse injuries in youth sports, particularly over the last 5 to 7 years. And we've been seeing injuries happening in younger athletes, and injuries that we typically wouldn't see until you get to the collegiate or the professional level, starting to creep into our high school and sometimes even our middle school athletes. And it's really due to this single sports specialization phenomenon that we've seen creep into youth sports over the last 10 years. So if there is a silver lining in all of this, I do think it's the fact that we've had some dedicated rest time during which athletes can help to rehabilitate their bodies and to take a break from an overuse activity.
And it might help them perform better in the long term. I know you have a lot of young patients. Can you discuss how they were impacted really beyond missing sports and beyond COVID? Because even, mental health and the sense of isolation is really profound.
Yeah, there's no question that, we all think about youth sports in terms of the enjoyment of the activity and the participation, but there's many intangible aspects of youth sports. And I think what we've seen is that the absence of youth sports has really led to a rise in things like depression, social isolation, and the fact that mentally it does affect youth. In addition, it's for many youths, it's a reason that they are engaged in school, that they're motivated to keep their grades up. And for some of these individuals, it provides them with an opportunity to get a higher education or to perform at the next level. So I think when we think about the value of youth sports, not just from an athletic competition standpoint, we have to be cognizant that there are significant peripheral aspects of youth sports that are really important to the growth and development of our children.
Other states have returned to play really safely with few COVID-19 infections, really with recommendations from doctors like you. So what would you tell the parents out there and the students in terms of getting back to play, but also really still being cognizant of COVID-19?
Yeah, I think it's a great point. There have been studies. There was a very well done study from Madison, Wisconsin, that looked at their rates of COVID infection. And I think the key here is to remember that, it's not a one-size-fits-all phenomenon, and that's true of the country, but it's also true at the state level. We have to be cognizant of what's going on in our communities, and if the COVID risk gets too high, that may prompt a second shutdown of athletic activities. Secondly, is we know that we can't get away from some of the basic principles that have helped us to turn around the COVID crisis in our state particularly. These are things like masking and distancing, modifying practices when possible. And although we can't do that 100% of the time when we're participating in sports, we know that we can do it a vast majority of the time. And then finally, testing. I think that's the most controversial one, but that certainly led to success in other states and at our collegiate and professional levels. And I think we should be cognizant with testing becoming more available, things like antigen tests in association with PCR tests. When and if possible, testing should be part of the equation in terms of a safe return.
Dr. Verma, really helpful information. Thank you so much.
Thanks for having me.